often people have made the cigarette like their best buddy. Yeah, this is my buddy. And one of the ways we have to help them think about it is like, this is like being in an abusive relationship, right? You know, only a cigarette knows how to make you feel a certain way, but it's killing you. And you need to figure out how to break free of it.
I think we hear a lot about the longer term. We hear about the heart disease and the cancer. But the shorter term are very important as well. More pneumonia, more severe influenza, more sinusitis, chronic cough, more shortness of breath. So all of those kind of symptomatic things, as well as pneumonias, which at one time were very common amongst HIV patients, we see those much more in smokers. And within a fairly short period of time after quitting, people will already feel better. First of all, in terms of HIV, we have very good data in the context of HIV infection, that smoking is common, that smoking has short-term consequences for infections, for immunity, and that it has a very large increase in mortality. The estimate is about a 3-fold higher mortality. Before you start treatment, if you're a smoker, your immunity is getting worse more quickly. And once you start treatment, you get better more slowly. You still get better. It's these treatments are still highly effective even if you smoke, but you will gain your immunity back more quickly if you don't smoke.
Current statistics suggest that quitting smoking for improving mental health, specifically depression, is the equivalent of taking an antidepressant. So if somebody has HIV and has depression or anxiety, all of those symptoms immediately get better in the short term with quitting smoking. I'll grant you that initially it's a bit scary to give up smoking, but in the long term, you do that. So those are the medical, psychiatric improvements that we've talked about. But there's a financial improvement that occurs immediately, because if somebody is not spending $8 a day or $10 a day on a pack of cigarettes, within a week they've got 70 extra bucks.
And oftentimes reduction is a first step, sort of a damage control, a harm reduction is if I can get somebody from 40 cigarettes to 30 or 20, right. I still feel I'm helping their health, and sometimes going to zero is just too quick, too fast.
Generally, the estimate is that if you quit before your 40th birthday, you gain 10 years of quality life years. And so that becomes, you live as long as if you were never a smoker. So quitting before 40 is really a very important way from a longevity perspective and quality of life. But even if you quit later in life, 60, you can gain 3 additional years. And so, when practitioners say, well, the person's old, why bother? I say, we have to make sure we understand this, that when the runway is getting shorter, even that little time is very important to people. I had a screensaver behind me on my computer, which was went behind my head, to tell the patient, quitting smoking is a process, not an event. People often trust what they've experienced. They have been anxious, they feel anxious, every day they feel anxious, and they have a cigarette and they calm down. What people don't realize is that actually that is because the nicotine levels are beginning to drop. And nicotine withdrawal is manifested by anxiety. So that's what happens. So people say, oh, well, I'm much calmer now. And often when we can help people get onto the other side of that withdrawal, they suddenly say, wow, I'm way calmer now than I have ever been.
The anxiety, the depression, the ability to cope with stress, in the long run improves tremendously if you're a non-smoker, even though in the short run it sometimes becomes their coping mechanism. I tell people who are well controlled with HIV that the most important long-term health implication is related to smoking. But obviously we need to control the HIV, we need to try to help people stop smoking.